The specter of another pandemic is not a matter of if, but when. Experts warn that our interconnected world, coupled with factors like climate change and demographic shifts, is creating a perfect storm for the emergence and spread of infectious diseases. As we encroach further into wildlife habitats, the risk of encountering novel viruses lurking in animal reservoirs increases exponentially. The next pandemic could arise from a remote jungle, a bustling city, or anywhere in between. The threat is real, and the consequences could be devastating. The COVID-19 pandemic served as a stark reminder of our vulnerability to infectious diseases. It exposed weaknesses in our healthcare systems, disrupted global economies, and tragically claimed millions of lives. We cannot afford to be caught off guard again. Scientists and public health officials are sounding the alarm, urging for proactive measures to prevent, detect, and respond to future pandemics. This includes investing in research to understand viral evolution, strengthening surveillance systems globally, and promoting international collaboration to share information and resources. The next pandemic may be inevitable, but its severity is not. By heeding the lessons of the past and embracing a proactive, coordinated approach, we can mitigate the impact of future outbreaks and protect the health of our planet. Deep within the emerald depths of the Amazon rainforest, a different kind of battle is being waged, a silent war against invisible enemies. Here, amidst the cacophony of the jungle, a dedicated team of scientists, known as virus hunters, are on a critical mission to identify and understand potentially pandemic viruses before they make the jump to humans. Armed with syringes, vials, and cutting-edge technology, these modern-day explorers venture into the heart of the rainforest, collecting samples from bats, monkeys, rodents, and other animals known to harbor zoonotic viruses. Their work is not for the faint of heart. The jungle is a challenging environment, teeming with venomous creatures, stifling humidity, and unpredictable terrain. Yet these scientists persevere, driven by the knowledge that their efforts could hold the key to preventing the next global health crisis. The viruses they seek are elusive and often deadly. They lurk in the blood, saliva, and feces of animals, silently evolving and adapting to their hosts. By collecting and analyzing these samples, researchers can gain valuable insights into the genetic makeup of these viruses, their potential to infect humans, and their ability to spread. The work of virus hunters is a race against time. As human populations expand and encroach further into wildlife habitats, the risk of spillover events where viruses jump from animals to humans increases. Early detection and characterization of these viruses are crucial to developing effective vaccines, treatments, and public health interventions. The Amazon rainforest, a vast expanse of biodiversity, is a breeding ground for new and emerging viruses. Its warm, humid climate, coupled with its incredible diversity of animal life, creates ideal conditions for viruses to thrive and evolve. Scientists estimate that the Amazon basin harbors thousands of undiscovered viruses, many of which have the potential to infect humans. The rainforest's dense canopy and intricate network of rivers and streams provide ample opportunities for viruses to circulate among different animal species. Bats, in particular, are known to harbor a wide variety of viruses, including coronaviruses, rabies, and Ebola. As deforestation and human encroachment continue to fragment the rainforest, the risk of contact between humans and wildlife increases, raising the potential for viral spillover. Researchers are particularly concerned about the emergence of novel coronaviruses, a family of viruses that includes the virus responsible for the COVID-19 pandemic, SARS, and MERS. Coronaviruses are known for their ability to jump between species, and their genetic diversity makes them difficult to predict and control. The Amazon rainforest is a critical battleground in the fight against future pandemics. By understanding the viruses that circulate within this unique ecosystem, we can develop strategies to prevent their spread and protect global health. The COVID-19 pandemic, a stark reminder of our interconnectedness and vulnerability, has left an indelible mark on the world. As we emerge from the shadow of this global crisis, it is imperative that we reflect on the lessons learned and address the challenges that remain in order to prevent history from repeating itself. One of the most crucial takeaways from the pandemic is the paramount importance of investing in pandemic preparedness. This includes strengthening public health infrastructure, bolstering surveillance systems, and supporting research and development of vaccines and treatments for emerging infectious diseases. The pandemic also exposed the fragility of our global supply chains, highlighting the need for more resilient and diversified systems. Additionally, it underscored the critical role of clear and consistent communication from public health officials in times of crisis. Despite these hard-won lessons, significant challenges remain. Public fatigue with pandemic measures, fueled by misinformation and distrust in authorities, poses a significant threat to future public health responses. Addressing this fatigue requires sustained efforts to rebuild trust in science and public health institutions. Section 5. The Vaccine Front, a shield in progress. The rapid development and deployment of COVID-19 vaccines stand as a testament to human ingenuity and scientific collaboration. These vaccines have played a pivotal role in mitigating the severity of the pandemic, saving countless lives and paving the way for a return to normalcy. However, the fight against COVID-19, and indeed against future pandemics, hinges on continued innovation and equitable access to vaccines. Scientists are working tirelessly to develop next-generation vaccines that offer broader protection against emerging variants and potentially even against future coronaviruses. These efforts involve exploring novel vaccine platforms, such as mRNA and protein subunit vaccines, as well as investigating new delivery methods, including nasal and oral vaccines, which could enhance ease of administration and potentially provide mucosal immunity. Ensuring equitable access to vaccines remains a pressing global challenge. While significant progress has been made in vaccinating populations in high-income countries, vast disparities persist in low- and middle-income nations. This vaccine inequity not only perpetuates the pandemic, allowing the virus to continue circulating and potentially mutate, but also exacerbates existing health disparities. Section 6. Combating complacency, overcoming pandemic fatigue. As the immediacy of the COVID-19 crisis recedes, a new challenge emerges: pandemic fatigue. This weariness, characterized by a decline in adherence to public health measures and a waning sense of urgency, poses a significant threat to our collective ability to respond effectively to future outbreaks. Overcoming this fatigue requires a multi-pronged approach that addresses both the psychological and societal factors at play. Sustained public health messaging that emphasizes the ongoing risks of infectious diseases, highlights the importance of individual actions in protecting oneself and others, and combats misinformation is essential. This messaging should be tailored to specific audiences and delivered through trusted channels, including healthcare providers, community leaders, and social media influencers. Furthermore, addressing the underlying socioeconomic factors that contribute to pandemic fatigue is crucial. This includes providing financial and social support to individuals and families struggling with the economic fallout of the pandemic, addressing mental health needs, and ensuring access to essential services such as healthcare and childcare. Section 7. Bridging the Gap, Addressing Health Inequities. The COVID-19 pandemic has laid bare the stark health inequities that permeate our societies. The virus has disproportionately impacted marginalized communities, those living in poverty, people of color, and those with underlying health conditions. These disparities are not merely a matter of biology, they are deeply rooted in systemic racism, socioeconomic inequality, and inadequate access to healthcare. Addressing these inequities requires a fundamental shift in our approach to public health, one that prioritizes equity and social justice. This includes investing in community-based healthcare, expanding access to affordable housing, addressing food insecurity, and dismantling structural barriers that perpetuate health disparities. Furthermore, it is essential to engage with marginalized communities in a culturally sensitive and respectful manner. This involves listening to their concerns, understanding their needs, and working collaboratively to develop solutions that are tailored to their specific contexts. Section 8. Navigating the Political Minefield, Public Health versus Politics. The COVID-19 pandemic has tragically exposed the politicization of public health. Misinformation, distrust in science, and the erosion of public trust in institutions have hampered our collective response to the crisis. Navigating this politically charged landscape requires a renewed commitment to evidence-based decision-making, transparency, and open dialogue. public health officials must prioritize clear, accurate, and timely communication that is grounded in scientific evidence. This includes actively countering misinformation and disinformation, engaging with the public in a transparent and accountable manner, and acknowledging uncertainty when it exists. Building trust in public health institutions requires rebuilding relationships with communities, particularly those that have been historically marginalized and underserved. This involves listening to and valuing diverse perspectives, addressing past harms, and working collaboratively to develop solutions that are equitable and just. Section 9. The Vigil continues. Research and preparedness for a safer future. As we emerge from the shadow of the COVID-19 pandemic, we must remain vigilant in the face of ongoing and future infectious disease threats. The lessons learned from this global crisis must serve as a catalyst for sustained investment in research, surveillance, and pandemic preparedness. Research into emerging infectious diseases, including the identification and characterization of novel viruses, the development of new vaccines and treatments, and the understanding of viral evolution and transmission, is paramount. This research requires sustained funding, international collaboration, and the sharing of data and resources. Strengthening global surveillance systems is crucial to early detection and rapid response to outbreaks. This includes investing in laboratory capacity, training healthcare workers, and establishing robust data-sharing platforms that allow for real-time monitoring of disease trends. The COVID-19 pandemic has been a stark reminder of our interconnectedness and vulnerability. By embracing a proactive, collaborative, and equity-driven approach to public health, we can mitigate the impact of future pandemics and build a safer, healthier future for all.